All right. Welcome, everyone, to the second event in MassChallenge's Health Equity Series, Health, Equity, and Government. So for those who may be unaware, our Health Equity Series is a part of MassChallenge's HealthTech program. The HealthTech program was launched in 2016 and was designed to be a digital health innovation hub. Every year, we source innovative startups and connect them with industry-leading partners and collaborators as they work in pursuit of shared goals. Health equity has emerged as an overarching challenge area for the past 3 years across our health tech community. And although recent events have brought much needed attention to both surface level and structural inequities, we understand that these are longstanding issues and created this series in hopes of fostering long-term dialogue on these topics. This year, we have a 3-part series. Our first event centered on health equity and data, exploring questions around the collection, analysis, standardization, and distribution of health data. But today, we are excited to focus on the role of local, state, and federal governments in pursuing health equity and how the private sector can work in concert to drive innovation and support public health goals. So with that, I'm very pleased to introduce the moderator for this discussion, Adam Zellner from the MITRE Corporation. Adam is a bioengineer with healthcare industry experience at leading companies, including Pfizer, Zimmer, and Epic. He holds a Master of Public Policy and is a portfolio lead for the Health Enterprise Modernization Division at MITRE. So thank you for being here, Adam, and to the entire MITRE team for their years of partnership with MassChallenge. And joining Adam today are Dr. Abdul Sheikh and Dr. Didi Ray. Dr. Sheikh is principal for population health analytics for AWS Worldwide Public Sector Healthcare. He works with a multidisciplinary team of solution architects and data scientists helping academic medical centers, government, and nonprofit organizations harness data for biomedical research, clinical practice, and public health. Dr. Ray is an innovator in public health emergency management at the intersection of medicine, data, health equity, and public health, and works as a director of data and analytics in the NYC Health Department's Division of Environmental Health. So thank you all for joining. Thank you everyone for participating in the audience. We'll have time for questions at the end of our discussion, but for now, I'll hand it over to Adam to kick us off.
Thank you, Lucas. And thanks for everyone to join this great event. Huge problems in our country really need collaboration from the startup ecosystem, federal government, local government, and our global partners. So I think it's a great panel we have, and I think it's very appropriate that we have Dr. Sheikh, with Amazon Web Services, the biggest mover and shaker in terms of our internet economy and world. And especially coming from a global perspective. And then I really sit in a federal government perspective. MITRE really supports the Department of Health and Human Services, and we don't get into the weeds at the city or state level as much. So I think, Dr. Ray, you bring that boots on the ground, local government perspective that we all need so much. So I guess the first question that we have is really for Dr. Ray, and being down at the ground level, what do you see as the role and responsibility of local and state governments regarding public health and health equity?
Thanks so much, Adam. Yeah, and so this is always an interesting question, and I feel like in different models, I trained in global health. You sort of see this pull between like federal standards and like local initiatives or sort of decentralized initiatives. And I think within the US, that's like especially pronounced because we have our state system and our federal system. And, the question of which rights are allocated to which group is has been a government tension question throughout our history. I think that, as we talk about health equity, especially, and as we talk about a public health that is now focused on health equity, I think that we're at a point where we need innovation. There's some things that are set in stone as minimum standards by the federal government, but I think in terms of health equity, this is something that has to occur on a local level. You have to have deep knowledge about barriers and assets of groups within your local community. So we're starting to call this the hyper local, right? And in emergency management, I think emergency management is in principle centered on the local. So there is a saying that in disasters, which now disasters and public health have come together in an unfortunate, but that's reality kind of way. In disasters, they often say, and this is actually a federal statement from a former director of FEMA, you say that all disasters are local, and then you also say that the local community groups, right? So even like a sublocal or a hyper-local group are the first and last responders in a disaster. So in situations where we're in right now, many of the most successful initiatives have been, I think about in my neighborhood in Queens in New York, they're grassroots, spontaneous mutual aid networks. There are other networks about protecting people in housing and that really attack the social determinants of health. And then of course there are health startups as well, health startup local groups. And I think that the role of local government at this point is, of course, to produce its own initiatives. But I think that a model of shared leadership where the government is working closely with the successful innovators in the community is the model we're looking at now to improve health equity and will be the most successful. And then I think, there is an ideal where you have organizations that where government maybe hasn't fulfilled this obligation perfectly for every hyperlocal unit. I think that at that point, we also have to talk about funding successful groups rather than imposing ourselves on them, sort of elevating those groups and facilitating scaling their work to other similar, not even jurisdictions, but like neighborhoods.
Yeah. I think it's interesting that you bring up emergency preparedness and response, because the people that I work with, some in our public health units, they actually look back to 9/11 and the local response at Ground Zero in New York, that it was a challenge that no one had ever faced. All of the processes with the National Disaster Medical Service and FEMA and the Assistant Secretary for Preparedness and Response really kind of came from that response to 9/11. So, it starts local, you respond to the problem at a local level, but all those learnings and all those processes kind of settle in the government and eventually spread to the rest of the country.
I think that's the ideal, right? That these innovations are listened to and elevated in a way that they don't stop at local, in a way that things that are successful get shared widely and are elevated to the state and elevated eventually to the federal government in a sort of generalized format that works for multiple localities.
Mm-hmm. And I'm sure that it could always be faster. I think that the spread of these processes and technology could be faster, but the government is slow. And I think that's where there is a opportunity for startups and kind of like the market to kind of push some of these out to patients. And that's a great segue. So Dr. Sheikh, how do you see Amazon at, Amazon's role in accelerating some of these public health and equity issues to not only the US, but around the world?
Great question, Adam. I think that there's a moral imperative, clearly, right? Not just for Amazon, but all of our employees, our customers, our partners. There's the economic imperative, right? We've all seen data around just the costs of inequities in care. It's in the hundreds of billions, right? Not just excess medical care, but untapped productivity, all the other challenges that come out of inequities. Then there's the real push towards social impact investment, right? And that's been really heartening, because I think the heart of that is really looking at collaboratives across nonprofit, commercial, and even government partners in different models. And so when I think about Amazon and what we're trying to do, our leadership principles, they start with customer obsession, right? If we are not meeting the needs of our customers, which include all levels of government, nonprofits, and other organizations, I don't think we're going to be successful. And that's been one of the secrets to our success. I'm also proud of one of our newer leadership principles, which is success and scale bring broad responsibility, because there's an explicit recognition we have that what we're doing at scale, it means we have a responsibility to do better for our customers, for our partners, our employees, and the world. And so I think what's been really cool to see is some of the programs that we've been launching. Like we have a health equity initiative, which was launched recently. If you just Google AWS Health Equity Initiative, it's a global program, $40 million. And it's really, allowing us to support any type of organization that wants to use the cloud, wants to use analytics for 3 broad areas of focus: increasing access to health services, reducing disparities by addressing the determinants of health, and then looking at how to promote equitable and inclusive systems of care. So those are very broad categories. And I'll stop for now because we have other programs that maybe I'll get to later. I hope I can. But I think I'm pretty excited because my vantage point at AWS, along with the teams that I work with, we really are able to look at the opportunities and the gaps across different sectors, including different levels of government, which I know we want to talk about today.
Absolutely. So broadly, where could the federal government do more, or what is the federal government not doing correctly right now to bring people together, to share data, and achieve some of the health equity goals that we're talking about here?
Dee Dee, you want to take that first, or you want to pass it to me?
Yeah, well, I think one of the big things is to really connect. Like, I see a lot of the role of the federal government as, connecting things and that scaling successful solutions. And I think that, and this happens in all of government, most systems in government have a hierarchy. And so you end up with a space between people who are working directly, with people on the ground. And you said, you talked about me as being on the ground, and I don't even think of myself in that way because I'm not out in the community every day. I'm not every single day talking to people, elevating, bringing up their concerns and coming up with their solutions. I've come up with a couple innovations toward health equity at the health department. And I think that, nobody knows how to get those bigger attention. Like, I think that at the moment, these decentralized systems, like the problem with decentralized innovation is that it is hard to get it to a point where people can understand how to adapt and scale it. And so I think that just as local health departments are looking in a hyper-local way at their communities, I think that the federal government can, in trying to support them, scale them, partner with them, I think that there is a space to do that with these sort of decentralized innovations. But I also think that you run into some, where at every level, at micro levels within the government, it's hard to get your idea up the chain. And I don't know exactly what the solution is for that.
Dr. Sheikh, anything to add?
So, I agree with Dee Dee, right, that it's challenging. And I've been heartened by the Biden-Harris administration, right? You might have seen they just released the agency equity action plans. And I think those are exciting because they're looking at this as a complex system, right? And they're looking at this at the level that they need to start, which is across the different national departments, labor, housing, HHS, and they're really trying to align around what these different agencies need to be doing, both on their own across their subdivisions and operational divisions, but also across. But I think that, it's also been really interesting to see COVID as a catalyst for change, right? We've all seen that. Dee Dee, you've been on the front lines of public health for that. And many of the customers I've worked with in my prior role, as well as AWS, we've been really trying to push the needle around how learnings from COVID response can really drive broader approaches to care, to social services, to connecting the dots across these different types of supports we need. But for the federal government, hey, you know what? They are now investing, they're recognizing we need to invest in modernizing data infrastructure, right? So we've seen the dollars, we've seen the statements, we've seen the support coming out. And now it's incumbent on levels of government, right? State and local, to figure out, you know what, we've been tooting the horn for investment in modernizing public health data infrastructure, right? In meaningful community engagement and capacity building, because you can have the best platforms and analytics, but if your people don't know how to use them, you know, you need to build that capacity. But we're at an interesting point where that's one of the big challenges that my teams and I are seeing, right? How do we help support building that capacity, modernizing that infrastructure, if we're talking about data in this case, but data is not in a vacuum, right? How is that data going to be used, harnessed for care, right? Be it public health, be it clinical, be it F2HCs, be it social services. So, you know, it's an exciting time, but I think it really is important. I think, Didi, I'll come back to what you said earlier, right? That we have to start with the community. I think we have to start with understanding, like others have said it better than me, you know, nothing for us without us. Right. And we're seeing that play out across the nation. And I think that's really exciting because the other day I was at a conference, and Abigail Echo Hawk, who is with the Seattle Indian Health Board, you know, she really shook the room in a positive way by talking about this legacy we have of data genocide. Right. And part of that in public health and healthcare is this deficit model. And when we look at communities that are at risk, that are underserved, traditional minority communities, you know, it's not always about what they need because they're lacking something. It's also looking at their strengths and how to learn and build from them. Anyways, I'll pause there. Lots of ideas around what we might do.
I think two things stuck out. One, I'm glad you mentioned our brothers and sisters on tribal lands. The Indian Health Service is rapidly trying to modernize their data infrastructure, but has just lagged behind other health systems. So do you see that opportunity for a startup or maybe a small tech company to work with populations that they might not go to first? The Silicon Valley or New York City or the Baltimore DC area, but maybe Medicaid populations, IHS, or what vulnerable populations have the same needs but aren't necessarily the first customers? Up to you there.
I think that's something that, especially because, problems like the Indian Health Service and its modernization are things that the federal government, can bring attention to, right? Where apologies, someone is doing some construction upstairs, apparently. But I think that's something where the federal government can bring attention and funding to those groups where they form, where if you decentralize core issues for certain populations, then that makes the innovation less powerful, right? And so I think that, in terms of that within federal government, I think that, for example, Amazon Web Services has broken ground, right, in creating platforms for people to share data, right? And so even if, we talked about this, like these bottlenecks in getting an idea elevated up in government structures, right? But that bottleneck doesn't have to exist when there are these horizontal mechanisms for sharing data, right? And I think the New York City Health Department did a lot of work in disaggregating data by race in New York City, but you will notice that our disaggregated data don't have Indigenous persons in them, right? And that is because of, statistical issues. It's because, like, on our own building it, this whole statistical mechanism, this data collection mechanism, de novo might be like, it's a big investment. And I think it's something that we're working on, but we're not going to alone have the resources to tackle this problem by ourselves. Mm-hmm. And I think that the issue is, and I don't want to trash anybody's systems, right? But for example, I know that government also often wants to build things on its own, but I do think we have amazing experts all over in the private sector, all over in startups, who are often already partnering with communities, or who have built model innovations, or who are experts at innovating in this area. And we don't necessarily have those people particularly located within government. And so I am just thinking about, just as a practitioner, the VA electronic medical records were excellent when they started, right? They were better than everybody else. But by the time that I was using them, they were very difficult to navigate, right? Yeah. Once I had been exposed to other electronic medical record systems. And so, yeah, I think that at that point, especially around data, especially around technology, I think that that's something where the federal government's responsibility would be, number one, to recognize needs, right? Like to recognize needs, for example, as they are doing with the Indian Health Service, and then to scale solutions that probably already exist somewhere else.
Excellent. Dr. Sheikh, anything to add?
Oh, I always have something to add because of this topic. Let's see. So startups, right? I really want to mention our support for startups. So if you Google AWS and startups, you're going to find our landing page where we provide a lot of support, a lot of credits to help startups understand what capabilities they can access around using data, using advanced analytics. I think this challenge around what can the federal and state governments do? One thing that I've been excited about is when you see this push towards collaboratives around data, right? Be it, regional data hubs or centers that can bring together different levels of government. So it could be state and local, it could be tribal government agencies in partnership with community stakeholders. Academics are always doing interesting things, and we want to get them out of their academic centers to engage with use-inspired research. So I think that's another point of advice I would give to the startups here, which is that, really look at those margins where you have these different players coming together. And I think that the heart of it is going to be the state and local governments, right? Because they have a vested interest, as Dee Dee has said, and we know in trying to drive response at the local level. And I think when you look at what startups can do, look at, well, one example I give, which is really cool, is in New York. We work with Metro Plus Health. It's a health plan in New York City area and partners. And, through that partnership, we're able to use natural language processing, conversational intelligence services to better engage high-risk patient populations, to provide them with access to not just healthcare, but also social services during the pandemic. And so that just came about, again, because there was a real strong need to address those underserved populations at a time of extreme challenge. But there's so many other opportunities where if you look at new analytics, bringing in data and partners, you're gonna see there's solutions and gaps that needs to be addressed.
Excellent. And one thing that I think both of you brought up is there is a digital divide between early adopters and people that are very fast movers in terms of these tech solutions, and then there are people who lag behind for various reasons. How can big companies like Amazon and also big innovative states like New York help the people that might be falling behind on tech adoption or tech literacy even?
I think that again starts with the communities, right? Like most people fall into a community group that is covered by a community organization or some other coalition or group. And I think the idea is not to start from scratch and replace those groups, but to create a forum where you can listen to those groups, right? And where when you do that, when you get a lot of participants or a lot of data, right, the question becomes, how do you achieve a consensus, right? How do you elicit the actionable items from all of these diverse perspectives? And I think for a long time, that's just been very hard, right? For a long time, we've had a model where we are representing, right, especially in democratically elected governments, we're representing the people in our interests. And if we don't know about a group, they're not represented. But I think that the value of this technology and innovation is really to bring together all of these voices. And of course, I think that somebody will know of a group, right? Somebody is already advocating for these groups that do not have the same digital literacy. And so those can be brought to our attention. I think about it as like a system of qualitative surveillance, right, that you can get. And I think that natural language processing tools help that. I think the ability to store a lot of data helps that. And I think that looking outside of traditional models helps that. Like, for example, disaster preparedness, right? Like, you start with a risk assessment that should drive resource allocation and planning. And those risk assessments are often done, at the best by having a conversation with community members or multiple conversations with community members. And at the worst, by having like 5 bros in a smoke-filled room pick out what hazards are the worst, right? And we found a way with limited capacity, using a model that's used in industry a lot called the analytical hierarchy process. So we figured out a way to just adapt that for the context of emergency response. And now we have a way where individuals from community groups, businesses, the healthcare sector, anybody who has touched disaster or can participate. What this does is it expands the definition of expertise, right? So lived experience as a disaster survivor, as a disaster responder, counts more than or as much as reading a book about disasters or studying it in school.
That's right. Yeah, I would add that, I think about the digital divide. One way to look at it is there's the issue of access, right, and cost, access to resources. And we know the FCC, for example, has done some really interesting work around broadband access in health. I love it. But there's also the issue of content, right, a digital content where, pretty much everyone can't keep up with the power of the crowd. When we look at the messaging on TikTok, on WhatsApp, on Instagram, on social media, versus, traditional, public health messaging, if we're talking about public health, right? And so that challenge means we need to think more creatively about how to automate tailoring of messages, targeting and tailoring in a way that, it provides information that can then be comprehended. Because I think, Didi, you mentioned it as well, right? There's a challenge around digital literacy, around numeracy. And so there's a role, I think, for government, for nonprofits, for industry to look at these, break down what we mean by the digital divide, right? Which is more like the digital continuum. I'm sure you've heard about it. And how do we then work together to tackle those different pieces? I think I've been pretty excited. I just included a link in our chat to a program which just launched today. And it's a $30 million impact accelerator for underrepresented founders. And so this is really meant to show our commitment to helping early stage startups led by Black, women, Latino, and other founders that are underrepresented. And so I'm going to put that out there as well, because we do need to have diverse and underrepresented voices in the room when we're talking about how do we tackle technology as a determinant of health.
I'll also add something that I think neither of us brought up specifically, but also it's also important to do it fast, right? Like, yeah, you can collect 10,000 viewpoints or 10,000, lived experiences, but if you do it over 10 years or 20 years, the people who have spent their time, who have given you their honesty, may not see the outcome of what you're doing. So I think that one place where the technology, where the infrastructure building can help here is to just make things faster, to make things more systematic.
Wow, they're really building some infrastructure over there, Didi.
Yeah, sorry.
Before we open it up to live Q&A, just a final question on kind of the disinformation, misinformation, and trust issues that have arisen in the pandemic. There's been fake, conspiracy online about different therapeutics or different tests or different evidence about the pandemic. What's the role there for state, local, federal governments to, set the story straight and, clean up the air, and so that the truth kind of gets through.
I don't mind going first here. So I worked in the city government and public health way back. I don't want to count the years, but then also in the federal government. And I find that, the challenge the government has, and the challenge public health has, right? If we're talking about misinformation and vaccines and COVID, is that we don't tell the story of public health well, right? Like even traditional, clinical and biomedicine tells a better story. It may be outdated, right? Like, hey, we're going to come up with a therapeutic or a drug or something, and then, tackle this disease or this acute issue. That's a lot harder for public health, right? Traditionally. And I think if we can tell that story better, the value of public health in a way that's relatable, that's, I think, going to be incredibly important. The other piece is, I think, Didi, you've been mentioning it, the meaningful engagement, right? Government needs to engage meaningfully with communities, with diverse communities across the board, right? They haven't done a good job of it. And part of that engagement is, speaking at a level that's understandable, but not dumbing things down, right? Communities don't want us to spoon feed them. People, want to be told the truth. But I think it's doing it in a way that's relatable and relevant. And part of that, I think, when we talk about data, and in my world, and I would say our world, right, in general, is how do you make data tell a story, right? How do you visualize it? How do you contextualize it and make it compelling so that you're actually getting across messages around, for example, relative risk, right? Or around, the need for vaccination or so on. What do you think, Didi?
Yes, I absolutely agree. And I think, we have to acknowledge that there is a lack of confidence in the government for very good reasons. And it's definite, there have been active inequities that have been in the past and are still being propagated by governments. And so I think that the first thing we have to do is just say that. And there is real mistrust. I think there is also a very well-funded professional misinformation machine that is working. It's better funded than we are, and it is, working 24 hours a day. So I think that the stories help, right? And I think that this is where the hyper-local listening comes in, right? Because then you identify specific barriers, specific questions, specific assets, and you can tailor your messaging, tailor those stories to them. And I think we have to just find a way to do this systematically, and we have to find a way to do it fast. I think COVID is another place where these lessons have come up, right? Where people who never would have shared their expertise before are getting on these big, sort of collaboratives to share their opinions, share their experiences around misinformation. Doctors are sitting with community members. Doctors are sitting with, people who have very little faith in the healthcare system. The government's meeting people where they are. I think the health department actually produced, and many other organizations, but I know that the health department produced these, story videos based on this large qualitative surveillance that we have through social media monitoring, through individual interactions, through large groups of the health department collaborating, where we've identified sources of misinformation. And in near real time, we sort of identified best strategies like, don't bring it up, but if it comes up, you want to bring this up because it's a primary concern, et cetera, et cetera. And I don't know if that's the answer, because of course the misinformation is moving faster oftentimes than we can protect against it. I guess I would say that one thing that government can do is, again, share that responsibility outside of government. Understand that, maybe you want to fund something and not put your government name and logo branded right on the top, right? So maybe if other people are doing this well, part of scaling it up means to fund that, right? And to think about it in terms of what is most successful, rather than, putting first how you're going to be held accountable for what your contribution was in the funds you provide.
Yeah. And I think it gets back to where you interface with information from. And I think a place like Amazon is actually one of the more trusted information purveyors in America right now, because of how often people engage with Amazon. If you're doing your shopping, if you're using Amazon Web Services, I think this responsibility really goes all throughout our health ecosystem, which Amazon's a part of. But so now I'm looking at the chat. We do have an open Q&A session. So anyone is now able to come off mute or put a question in the chat if there's something specific you want to talk about. But until then, Dr. Sheikh, another thing that you brought up was the way that COVID has really changed our lives and moves things more onto the internet. We rely on telehealth for primary care visits. People look up more of their health information online and are expected to download and interact with it more. What are the challenges that this new normal presents with us? Even though it has some gains in terms of speed and distance, what are some of the challenges you've seen?
Well, and I'll actually go back on something else you mentioned, which came to mind, which is that AWS, Amazon Web Services, is a separate business entity from Amazon.com. So we're all under the Amazon umbrella, but Amazon.com is the consumer website, providing goods and services, as we know. And Amazon Web Services, as you might know, is the cloud, right? And it is the cloud computing arm that we have, where we do place a high regard on, the data that our customers entrust us with, and what they need to then be able to be doing with that data. But okay, so your question, one thing that I want to, I think, share, because this is something that came up in a recent workshop at NIH around bias and responsible use of data and AI, which I think it really resonates, is, when we think about data and data scientists, right? I think one challenge we have to address in healthcare writ large, clinical public health biomedicine, is that we need to integrate data scientists with the clinical and public health folks, because when we're thinking about how to identify and mitigate risk of bias from data, right? Be it how data is collected, its provenance, or how it's used, not just in a very advanced machine learning approach, but also in more basic statistics. And then how that data is then presented and shared and then digested by others. Data scientists are key in that process. And we need to, I think, allow them to be on the front line of the intervention points. So be it for decision support in clinical settings, or around, coming up with public health strategies for addressing different challenges, be it environmental health, COVID response, chronic disease prevention and control, because that's going to allow, I think, an important shared learning to take place, right? And that's because I think what we're seeing now is a slow shift, and I hope it accelerates in schools of public health and schools of medicine, to increase the data savvy, the analytic savvy of our early practitioners, right? And I don't know if that's something that either of you have noticed, but I think it's good that we have NIH, the National Science Foundation, these large academic funding entities, looking at how to bridge the divide across these academic disciplines, because that's playing out in practice as well.
Absolutely. I think the workforce issue is huge right now, and something CMS provides grants for the residency programs, and HRSA provides all sorts of funding for HPSA's health professional shortage areas, and those have only gotten worse, in the pandemic. So that's a place where the federal government can step in, but I think there needs, medical education has to shift, and the workforce training has to shift to adapt to this new business policy and complicated reimbursement model that we have in healthcare.
And I think that brings up a great point. And I think over the last 10 years, maybe 15 years, public health has seen a lot more integration of data. Even medicine has involved a lot more incorporation of understanding data, analyzing data, being able to interpret data on your own, and to explain it, from non-data scientists, right? However, I think there's still these old ideas. Now, when I switched from clinical medicine to public health, I remember I was at a job fair or something, and they said, you have to pick data or you have to pick policy. Right now, I was clinically trained at some very good places. I also have a math degree, from undergrad, and I've always been interested in data. And I'm also interested in health equity and global health, right? And I think that we also need data scientists to be better versed. Data scientists are not automatons. They're not an extension of machine learning that just does an analysis, right? Data analysts in public health and in healthcare need to understand policy, right? Understand the impacts of policy. It's no longer, here's my analysis and I hand it to you on a piece of paper. An analysis is just as tailored as a policy brief, right? If data has an opinion, data have an opinion, I guess. And so I think that we need data scientists to understand the policy, right? They need to understand a little bit more of what goes into leadership decision making, and then they need to be in the room with leaders, right? This needs to be an exchange. I feel like a lot of the time with data, there's a product that comes out, and then leadership feel that their value is taking this and running it with it and making a thing out of it. But I think a new definition of leadership is really to have people who know more about stuff with you, about a particular area than you, but everybody is on the same page and everybody's having a conversation.
That's right. Yeah, one of the terms I've heard is taking an equity lens to data. I love that, right? Because it does call for a bridging of the more technical data scientists who are often a step removed from where that data is actually used and applied, right? And it calls for then looking at issues around data quality, representativeness, and minimizing bias. All of that is essential, I think, especially as we start looking at the responsible use of machine learning, right? And so I'm going to try to include a link to this, but we, AWS, we've released a responsible use of machine learning guide, and it's meant to be a starting point to talk about how machine learning has to respect the rule of law, human rights, equity, privacy, fairness, but it gets into approaches around the design and development and deployment of these analytics approaches and tools, as well as around how do you then think about detecting bias and mitigation ongoing, right? Once your machine learning is actually deployed. Adam, I'm sure MITRE does a lot around this with your framework and teams.
Yep, and that is the core goal number 3 in our national strategy for digital health, to ensure that AI becomes a trusted component of healthcare. Right now, we've seen a couple slip-ups. There's been a few health insurance companies who have been dinged because their AI algorithms point clinicians to those who are most willing to pay, and just widen the gap between those who receive care and who don't. And it wasn't found out until that AI algorithm had operated for several months, and it was complicated. I don't think anyone meant to do that, but when you're using base data sets that already have inequities in them, the AI most likely perpetuates those disparities and has the potential to make them worse. So it's a blend between policy, ethics, public health, and engineering technology, which my whole life has always been a separate stream in the American education system. So I think people in government are trying to bridge that gap right now, but we have a long way to go. And I think it is up to our startups, the small agile companies, to kind of make these connections, because the larger, more established ones might be a little too slow. We did have one question, Dr. Ray. What is the best way to reach out if they want to engage further with the NYDOHMH?
I guess the question would be around what. I think that you can, I mean, you can always reach out to our external affairs office. You can reach out to me and I can pass the message forward. I mean, I'll say that I do get a lot of, software, like companies asking me if I can deploy their software, which is again something that like very few people are empowered to do at the health department because it means starting a procurement process. We have rules around minority and women-owned businesses, et cetera. But I think that our external affairs is good if there is a specific question, or a specific thing you'd like to engage about with your group, then I can try to help you find the right person. Like, for example, if you want to find community organizations, one of the initiatives that we worked on with an external company was trying to set up a literacy, math literacy program for communities where communities could use an easy to use interface to make their own maps of whatever they wanted. And I think stuff like that, we could definitely find a topic area and try to connect you at least with someone who might be able to do that.
Awesome. Angel, Lucas, we're at 2:50. Do we have any other questions or topics from the chat?
No more topics. If you have any more questions for the panelists, that would be great. But so far, anybody, if you feel, please feel we have a, how do we connect to Dr. Ray? That's a question, like the follow-up from the last question.
You can connect me on LinkedIn. Just be specific about your request because I get a lot of spam requests like that. So we're like, look at our software, come up with an idea of how you can use it and then buy it, So just let maybe say that you attended this panel. And I'd be happy to talk through, maybe the health department would be good, or maybe a community organization in New York City might be a good partner to offer help to.
For sure. I don't think we have any more live Q&A questions. If anybody else wants to ask our amazing panelists any questions, please do so. If not, Adam, if you have any more questions to ask, that'll be amazing as well. But
Well,
please feel free.
I just, open the floor. Any closing remarks? I think, MassChallenge is an awesome coalescer of great ideas that MITRE has supported for several years. And I actually was a participant back in 2013 when I was a startup entrepreneur, going around the Y Combinator accelerator circuit. And it really just showed me much more about the health system and what the power of technology was for healthcare. So thank you, MassChallenge, for all you do. But I'll leave it up to our panel to end with closing remarks.
Before we do have a question, a raised hand from the HHS. Here we go. Okay.
Hi, thank you, Angel. Thank you to the panel. It's been great to hear your thoughts. I think the diverse perspectives have been really great. Just to give you a quick background on me, my name is Leith States. I'm the Chief Medical Officer to the Assistant Secretary for Health in OASH at HHS. So, Bill, you'll probably remember OASH fondly, hopefully, from your days, and maybe Dr. Ray, in the same vein, you get some interaction with us at the state level. So in my role, I have a distinct opportunity, especially with this administration, around the area of environmental justice. And so the reason I wanted to posit a question to this group is I've been working in some capacity in a limited fashion with the Bezos Earth Fund around their open data collaborative around environmental justice. And at the same time, have been working to an extensive extent, to a great deal to develop or rekindle relationships at the community level around environmental justice data and what that hyper-local manifestation actually looks like. Because so much lip service gets paid to the idea of we want folks to have ownership of the data. What does that actually mean? Is it a DUA? Is it that they're developing it? Is it RPM? Is it something that they store and forward at some point to a provider, to some other cloud-based entity, but they still get ownership of data? Do they get to do what they will with it? Do they need technical assistance? What does it look like to actually make it do something, right? What is it going to do that's going to provide substantive impact, as opposed to just characterizing the problem in a different way with a new map with new colors that does nothing good at the end of the day, other than probably get somebody else reelected, right? And that's the jaded view, but I think that's the true view from a lot of communities and individuals that feel disenfranchised around this idea of open data. So I guess my thought would be, in the question for you, Dr. Ray, at your level at the state, and then for Dr. Sheikh, and I'm sorry if I get any names wrong, in your experience with NIH, with ONC, around Competes Act and developing challenge prizes, and now with your work at AWS, how do you see your nexus with the federal government, either being facilitated with some of the new openness around equity, or do you see barriers where you would want to see the federal government do something else? I know that's a big question, but hopefully there's some good food for thought that I'd like to hear. Thanks.
Sure. Didi, you want to go first?
Sure. And I mean, I think that that's a really good question. That's actually one that I'm pretty well placed to set up partnerships with, because I'm actually in my non-emergency job. I'm in the Division of Environmental Health, and there's a lot of work on, we already have a program that was started a while ago, which looks at hyper-local responses to, in heat emergencies and winter weather. I think we're always looking for data solutions around. New York City has a pretty good open data platform, but I think with, in terms of interacting with the federal government, I think that grant funding is a big way that we do that. And I think that in terms of like an idea sharing forum, I think that, I can't speak for anyone at the moment, but, that's something that we might be interested in participating. And I do think that we have like a unique and diverse experience with issues of environmental justice, and especially, climate change and the disparate responsibility and impact of climate change.
And then I love the question as well. I'm so glad that you posed it, because it does allow me to think about my time in federal service. And I think the Competes Act challenges, the whole Competes Act mechanisms have been really good in terms of driving new innovation, getting new ideas, harnessing public data with other kinds of data as well. And we're all familiar with the examples that have come out of those programs and those challenges. I think, where do you go now? One, I think, recommendation I would have is to look at how to advance equity across communities and health systems. And that means looking at how the federal government can help drive meaningful integration of climate data with clinical, epi, socioeconomic data to drive the need for that we see in underserved populations. The National Health IT Collaborative for the Underserved, NHIT, they're pretty active in bringing data together. We help them bring data together around a data fusion center. Those publicly available data. So there's some examples there, I think. I think the other two things would be to look at other models and approaches for how governments are working with nonprofits around different types of data. So I know the Norwegian Institute for Nature, they did a study on the correlation of air pollution and pediatric asthma. And they brought together like different kinds of data and models around extreme weather data as well, and how that can predict disease. So that's really fascinating, because you're cutting across different disciplines. And then I think I always get excited by new tools and analytics, right? And there's a lot out there in terms of how to harness different types of data, structured and unstructured, and how you can use that. But it does start with, I think, the federal agencies as conveners, as funders, to be able to then not just do like open-ended grants, which are good, but also even targeted pilots, right? If you can do a small pilot that can scale, that can then bring more interest and potential greater outcomes as well. I'll pause there. Love the question.
I want to build on that because that's a great point about the grant funding. And I think that I think there's a lot of fear around not meeting grant requirements, right? And not doing things in the way that a grant requirement requires. And of course, those grant requirements have to be, they have to be kind of universal across the country if the federal government is doing them. And so often they're either specific to a point where they end up not being useful at the local level, or they're funding things that are like a baseline minimum, and then the interpretation can be, let's just do the minimum. But I think there is a way that like some of the non-outcome measures might be good with grants, right? So I think contributing to these sort of, large collaborative networks where ideas are shared is a good thing to do. I think that the pilots, especially, right? Like, I think that there is a point to which, even though these are taxpayer funds, that like failure can be encouraged a little bit and not feared so much.
Sure. Thank you, everyone. Adam, I don't know if you were going to say something. You're muted. Sorry.
I just wanted to post something about patient identification still is a very big challenge in the US, which limits the ability of people to get copies of their data. And there's been a couple rules that have come out, but there are still some really American problems with how we have duplicate patients, duplicate records, duplicate levels of our public health system. And AHIMA just gave a good framework that I've been interacting with a little bit. I put that link in the chat, but that's it for me. We did have one other question about the AWS Black Founder Accelerator. I don't know if you, Dr. Sheikh, know about that, but
I would urge you to, I included a link in the chat, but if you Google it as well, it was just launched today, and it's a new program, $30 million to help fund underrepresented founders. Great program.
awesome.
Sure. Well, thank you for sharing that resource. And thank you, Adam, for being an amazing champion of MassChallenge and just always supporting us. Thank you to Dr. Didi Ray for coming back and sharing your great knowledge with us as well. We'd love to have you, and we'd love to have you again in more of our health equity initiatives. And Dr. Sheikh, thank you so much as well for sharing your knowledge and being so proactive throughout this engagement with us in this initiative as well. I dropped the link to our third and final event for our health equity initiative for at least this year. It'll be more focused on health equity internationally, just focusing on how we can achieve health equity or the challenges to achieving health equity in the worldwide lens. That's supposed to happen on May 24th at 3 p.m. That's a tentative date, but hopefully that's exactly when it's going to happen. But again, thank you so much to everyone for engaging with us. Thank you to our amazing moderator, amazing panelists. This initiative wouldn't happen without you and your great knowledge. But thank you so much. And I hope you all have a great day.
Thank you all.
Bye-bye.
Stay healthy.
Thank you.
Thanks, everyone.